everybody. Thanks so much for joining me today. My name is Samantha McAllister, and I'm the Director of Professional Services here at Nextech. The purpose of today's webinar is to discuss taking the leap to implementing a new software solution in your practice. We know that this is a decision that is not made lightly, and there are often concerns and hesitations related to making the switch. So today we want to address some of those concerns and hesitations by providing a transparent overview of Nextech's implementation process, so your practice has a better idea of what can be expected, and we'll specifically discuss some of the measures that Nextech takes to ease the transition for your practice. So before we dive in, I just want to point out a couple of things. On the GoToWebinar panel, there is a questions section, and you can feel free to enter questions throughout the presentation. We will be following up with you on your questions. And we are recording today's webinar, so you will be sent a recording as well. All right, we are going to walk through the go-live process. We're going to discuss data conversions, and finally, what you can expect after the implementation of your new solution. So let's start here with reviewing the go-live process. The first thing to understand about a new software implementation with Nextech is that you have a dedicated team of experts assigned to your practice to assist with the transition. Each implementation has a dedicated project manager that guides you through the entire experience from start to finish. After you've made the decision to partner with Nextech, your project manager is that industry expert who becomes your internal advocate throughout the entire process, helping you to navigate each phase and ensuring your practice has a smooth and successful implementation. During the process, your practice will also work with implementation specialists who are product experts that are responsible for the knowledge transfer of the software and guiding you and your team through our best practice approach to learning your new solution. Here at Nextech, we use a blended methodology of remote and on-site training. We leverage conference calls and screen sharing tools that allow us to take control of the user's screen and guide them through the software using a tested curriculum that is also supplemented by training material on our community portal. We also have our own internal technical services team who are responsible for the technical aspects of the implementation, such as the data conversions or diagnostic device integrations or interface setups, things like that. I'd like to dive a little deeper into the methodology and process that Nextech uses for the implementation of all of our software solutions. Something to keep in mind is that the dedicated team of experts that I've described, this is all we do, day in and day out. We've been perfecting our implementation methodology over more than 20 years, and it has been tested and approved by thousands of customers. We have a standardized best practice approach to our implementations that takes you through phases that build upon each other. The standard timeline for an implementation can be anywhere from 6 to 10 weeks, just depending on the combination of solutions that you're implementing. So we start with the engage phase, where we complete an initial project kickoff. We identify the key stakeholders, both on the Nextech and the practice side. And the most important part of this phase is the discovery process. Nextech takes the time to complete a workflow discovery so that we can better understand how you operate today and what your key goals are for the implementation. As I've stated, Nextech has a best practice standard approach to the implementation, but ultimately we want what's best for your practice. So we make sure to take the time and understand your current state and processes. The build phase comes next, and this is where we start customizing the databases, initiating the technical components, and completing required paperwork. And that quickly leads into the transform phase, where we begin the software adoption through our super user methodology approach. We empower your practice to identify super users to train your end users at your practice, ultimately preparing you for the go live phase, where your practice begins the live use of your new software. Once go live is complete, we move into the optimized phase, which is the beginning of your long-term relationship with Nextech, where you continue to have that dedicated attention that you need to ensure continued practice growth and success. And we're going to talk a little bit more about that soon. Let's talk about the approach that Nextech takes to prepare your practice for go live. I'd like to state again that software implementation is literally all my team does, day in and day out. So we have the experience that you'll want to leverage, and we have the tools to guide you successfully through this process. And it's our goal to help you transition with the least amount of disruption to your clinic. Some common disruptions that often intimidate practices during a software switch include patient volume reduction, time commitments for training, and change management in the clinic. So I want to start with addressing patient volume reduction. We know that choosing to switch software is an investment, and part of being successful at go live is reducing patient volume for the go live week. However, the practices that follow our best practice recommendations experience only a slight volume reduction on days 1 and 2 of go live, and then they're back up to 100% by the end of the go live week. Those best practice recommendations that I'm referring to come into place prior to the go live event, and one of them is anticipating and preparing for the time commitment for training. It is critical that as part of this software implementation, you allow key staff to have time to focus on the implementation. Everybody has a day job, and this implementation is in addition to that. So it's important to make the implementation a priority for them so they can dedicate the time they need to complete setup and participate in training. Another important note as it relates to time commitment is making sure your super users have the time scheduled out to train the end users of your practice. As I mentioned earlier, Nextech employs a super user methodology, which allows for you and your staff to be more independent long term. The super users are given tools and curriculum to train the end users at the practice. So making sure they have the time to do that is key to your success. The last common disruption overall is change management. And this is one of the hardest parts of any implementation. Human nature is just resistant to change, but we find this to be especially true when you're approaching a team of people who've been using another system for a long time. Process changes are also typically part of a new software implementation. So not only are you changing the actual software, but you may want to change or enforce best practice workflow adoption at the same time. Our recommendation for minimizing this type of disruption is to face it head on by making it fun. Acknowledge that some of these changes will come with growing pains, but they will also bring huge efficiencies and rewards. We recommend encouraging and rewarding staff members for being a positive force in your office during the transition. I had a practice years ago that rewarded their staff with fictitious money. They called it monkey money. And the staff members would earn the money for being positive during the transition, watching their webinars, covering for super users during training, going the extra mile, helping coworkers, etc. And then they had creative ways they could spend the money, like lunch coupons or PTO hours or cocktail coupons, things like that. The point is that they faced the change management head on, and their staff really engaged in a positive way throughout the implementation. And it's something we recommend now to every practice as a way of minimizing the disruption. A final keynote I'd like to touch on specific to training with Nextech is our solutions are extremely intuitive. So when we talk about minimizing disruptions and committing time for training, the fact that the system is intuitive means that the time you have to dedicate for training is minimal when compared to other software. Nextech is also specialty specific, so the time that is spent customizing content to meet your needs is minimal. Intuitive software has a long-term impact as well when you think about ramp up for new staff members. The software is so easy to use that a new staff member can easily be up to speed in a matter of weeks instead of months, like you may experience with other vendors. Now let's talk about the after the go live event, which is where Nextech really differentiates themselves from other vendors. Nextech provides a structured post-go live experience where we ensure that the software is functioning as designed and meeting your expectations, and we do so by assessing certain metrics that directly reflect the health of your practice. We have standards in place that have to be met prior to transitioning you to the optimization phase, where we complete the full implementation of your solution and hand you off to the dedicated team of experts you'll be working with moving forward. So again, we're not just taking you live and wishing you good luck. We follow a post-live standard methodology and ultimately ensure things like your insurance billing rejection rate is below 5%. We walk you through your monthly reporting and ensure you can complete a financial close. And from the EHR side, we set you up with a checks and balances system that will tell you whether or not each patient seen on the schedule had an encounter created and whether that encounter was billed. These are some of the key indicators of success that we use to confirm your practice has implemented our solution successfully prior to completing your go live. I'd also like to mention some additional resources that are in place for Nextech customers after go live. Nextech has a team of professional services consultants who provide an added level of expertise that will help your practice take the software to the next level. These services are typically provided after the initial go live event, and they allow you to continue to further optimize the use of your new software at your own pace. During the go live process, your practice may feel overwhelmed by the amount of information provided, so the professional services team can come in after the fact and ensure that you're using the software according to best practice and you're getting the most out of your investment. The final phase of the implementation process is the formal transition to your dedicated client success manager. After your implementation, like I said, you aren't just given a 1-800 number and left to fend for yourself. At Nextech, we dedicate a client success manager to each individual practice for the life of your partnership with us. We feel very strongly about the overall customer experience, and that does not end at go live. Your client success manager is your internal advocate and liaison, ensuring your long-term continued success with Nextech. Next on the agenda is discussing another common concern when it comes to switching software, and that is the data conversion process. When it comes to data conversions, you have options. Almost all of our practices choose to complete a practice management conversion, which includes information like patient demographics, appointments, both historical and future, as well as referring physicians. Nextech specifications for the practice management data are very standard and easy to adhere to, and our technical services team is responsible for the data import. Now on the EMR side, you have a few options, which really depends on the system that you're coming from and what data is important to you. The first option is a discrete data import, and I'd like to spend a little time explaining what discrete data means. Discrete data is finite specific values that can be categorized into a classification. And in the healthcare IT space, think about this as data in your EMR that is measurable and reportable. To put this into context, think about the EMR you use today. And say you're entering medication information for your patient. A non-discrete way of doing that would be if you simply had the medication name in one field and then dosage instructions in another field, where you're then entering one tablet twice daily for 3 days. A discrete way of capturing that same data would be if the dosage instructions were separate recordable fields. So medication name, dosage quantity, dosage strength, dosage units, frequency, duration, etc., all separate fields. So again, depending on the system you're coming from, there can be major advantages to converting discrete data because it takes some of the time away from having to prepare a chart for an existing patient in the new system. If the system you're coming from wouldn't qualify for a good discrete conversion, the other option is converting the data into PDF. There are even more options from there. Once you have the PDFs, you can choose to have them imported into your new database, or you can have them stored locally and pull them up for reference as needed. These are all options that the Nextech teams are well versed in and can provide guidance based on our years of experience. Also, something to note, a discrete data conversion requires a 12-week lead time. When you compare that to the PDF conversion option and even the practice management import, these would only require a 5-week lead time. So again, these are factors that we can help you consider when making this decision. The process for data conversions is similar regardless of the option you choose. So first, you, the client, submit the data to Nextech to complete the conversion. And from there, it goes through a testing process to ensure that you're comfortable with the data that's being imported, which we refer to as the accuracy test, after which you sign off with approval. All right, so we've already touched on the fact that you aren't dropped to a 1-800 number after you go live. But I'd like to dive a little deeper into life after implementation and what resources are available to you throughout your partnership with Nextech. Nextech has an award-winning US-based customer support team that boasts hold times under 2 minutes and same-day call resolution. So when you are settled into the software and you have a quick question about where setting is, or maybe you forgot how to send off your patient portal instructions, our support team is just a phone call away. And you can even create and track support cases from the community portal. Entering a support case from the portal allows you to get what you need without having to interrupt your day with a phone call. And it also allows you to track the status of your case. You can add notes, and you can also see what notes the support rep has sent to you. It's very user-friendly. Another post-live resource that we've briefly touched on is the professional services consulting team. This team is made up of very seasoned healthcare industry experts who've been using the Nextech platforms in clinic for years, and they have the expertise to help you optimize the solutions that you've invested in. They also offer regulatory packages that help you navigate the ever-changing landscape of the healthcare legislation and how that impacts your individual practice, like the MIPS program. Some other long-term resources available to you as a partner of Nextech includes our annual Edge User Conference. I personally have been speaking at this conference since its inception, and it's my favorite time of the Nextech calendar year. It really is. This is a 3-day getaway in Orlando, Florida, where you can focus exclusively on bettering your practice. We have keynote speakers, we have industry sessions, as well as plenty of software-specific sessions that are broken out by tracks so you can get the most out of your time there. We also offer time throughout the conference to really allow you to engage with your fellow Nextech users, which allows you to exchange ideas and just network within your specialties. In addition to our educational user conference, the community portal is available to our clients to access a plethora of self-training material just to further staff usability. One more thing I'd like to leave you with in regard to making the decision to invest in your practice with a Nextech solution is that I want you to hear directly from our customers. Vance Thompson Vision is a Nextech customer who recently went live with our software. They are a 19-provider ophthalmology clinic with locations across 5 states. Their implementation was meticulously planned out with one of our very experienced project managers, and then COVID-19 hit. Our initial project plan called for several days of on-site support for the go-live event, and due to the pandemic, travel was completely restricted. Nextech has been able to completely transition to an all-remote methodology, leveraging various technology to facilitate a similar feel of having a Nextech resource over your shoulder while going live with the software. The outcomes really have been exceptional, and Kim Bartles from Vance Thompson Vision said that though we were hesitant about a remote go live, the ultimate success came down to our team's preparation and the team at Nextech. There's something special about having key implementation team members like our trainer and project manager with clinical and leadership experience that know how to work with doctors. This was a perfect fit for our practice. They were upfront and responsive, even on weekends, helping us through the implementation process. So if another very relevant concern for you right now is related to changing software in the middle of the pandemic, you can feel very secure in the fact that Nextech has been very diligent in our pivot to an all-remote methodology, and you can still be extremely successful with the transition when you follow our consultative approach to the implementation. Vitreoretinal Institute in Louisiana is another one of our clients that recently went live remotely due to the pandemic. Their practice was in a circumstance that required an expedited go live, and our team of experts worked with them to do what was best for their practice. Lauren said, "We had to be up and running quickly, and Nextech got it done for us. They made it happen in an unbelievably short amount of time." All right, well, this concludes today's webinar. I hope you found it helpful. Like I said at the beginning, if you have any questions, there is that question section in the GoToWebinar panel. Feel free to enter those and we will follow up with you. Have a great day.